everybody. Thanks for joining us. We are back for our Wellness Wednesday. We're still doing our postpartum series, so I decided to extend it into April because I got a lot more I want to talk about. So today we're talking about low back pain. It's very common in postpartum. It's very common in pregnancy. A lot of women think, I'll just get through my pregnancy and then everything will go back to not hurting again. It doesn't always happen. The statistics are saying 50% of women still have low back pain after pregnancy. I think it's higher, but maybe it's because I see it all the time. So there's two types of pain that people usually come in for. It's either lumbar pain or SI pain. I was going to grab my spine here. Let me get it. Okay, so this is your back here. Lumbar pain's kind of in this area, and then a lot of women will also experience SI pain. And the SI joint is right here. It's between the sacrum and the ilium. So if you're kind of like right to the side of your back there, low back, on either side, you can have it in this joint or in this joint or in both joints. This sacrum becomes, this bone right here, or the tailbone that people call it, it becomes really unstable. It needs to move during birth. So that's good that it's movable, but it doesn't always go back to where it's supposed to be. So that can contribute to low back pain because these joints then kind of get inflamed. So things that kind of contribute to that, the birth does, the baby that was sitting on that for 9 months does, everything kind of has to get back to where it's supposed to be. But then also prolonged sitting on that area, because you're kind of, this is where these are your sit bones here. And then even if you're kind of leaning back, you can put some pressure on that tailbone too. So that can cause extra pain too, especially if it's out, you're putting pressure on bones that need adjusted. The unnatural sleeping positions, because we all know that happens. When I find too, what kind of hurts is if you try to stand up when you're holding the baby, especially if they're sleeping, that can cause a little bit of low back pain too. Then also there's the hormone relaxin is still in your body for about 6 to 8 weeks after you deliver. So you're still, the relaxin helps relax everything so that you can expand, so that the baby has more room to get into position. So that's still there. So you're just going to be a little loose anyway. So just the low back pain can really put a damper on your life and your postpartum experience. Being in pain is not okay, and you don't have to just put up with it. So there's a couple things you can do at home if you have like a SI belt. We have some here. But that will help stabilize that area. But more than anything, chiropractic, just coming in and getting everything aligned, especially the sacrum looked at, it just helps tremendously. I know all my patients that get their sacrum aligned coming in with low back pain, they notice a huge difference. So that's some two things. The SI belt and chiropractic will both help. There's some exercises that you may want to do afterwards too, to kind of strengthen the area back up again. Again, that Mutu that I mentioned in a previous video, that's a great system to go through to get everything strengthened back up again. So those are my suggestions for low back pain. Next week, we're going to be talking about neck pain and that nursing mother's neck, because when you're turning and looking down at your baby, that really, one day you're going to wake up and be like, I can't turn my neck at all. So we'll talk about some things you can do to help with that. You guys have a great Wednesday, and I will see you next week. Bye.